Dr. Hinshaw, you have acknowledged that some of your early summer decisions and modeling and assumptions were not the greatest. You've twice had to push back your dates for isolation requirements and mass public testing. You were nowhere to be seen for several weeks in public while cases were rapidly rising in Alberta. All of this happened while other medical experts were raising concerns about what was going on. I mean, why should Albertans or the government still have confidence now, given what we're seeing in hospitals and ICUs? Confidence in you, I should say.
Thank you. And I think it's an important question regarding trust. Trust is not something that I have control over others. And so people will have to choose, again, as they always have, who they want to put their trust in. What I have always done is, at every step along the way, I have looked at the evidence that's been available to me. I've consulted with colleagues. In early summer, I did recommend that we move to endemic, partly in consultation with colleagues who are doing similar policy changes with respect to removing public health measures, considering an easing of how we approached COVID, allowing cases to rise with an expectation that hospitalizations would be decoupled. And so again, that recommendation was based on what I had available to me at that time, and based on my belief that that was in the best interests of Albertans in terms of their overall health. Clearly, the move to endemic was too early. We saw early signs of that in early August when we did see trends that were not the same as what our modeling predicted. So the modeling helped us to be able to see that decoupling was not happening in the way that we had anticipated. And we were able to then move the changes later to be able to have more monitoring time. We continued to see that rise, and then I was able to alter my recommendations based on that evidence at that time. It is, of course, up to Albertans to determine where they want to put their trust. All I can do is continue to show up, to continue to do my best every day with my professional judgment, looking at the overall health of Albertans, COVID impacts, the impacts of restrictions, as well as the impacts of many other health issues that Albertans face. And it will be up to Albertans and decision makers to choose how they wish to work with me, but I continue to be committed to the overall health of Albertans and will continue to do my best every day for the province and for the people of this province.